name's Hannah Deacon. I'm Director of the Medical Cannabis Clinicians Society. I'll just do a little bit of housekeeping first, just so we all know what's going to happen. We're going to have a webinar for about an hour. Ariana, who's the founder and educator at CannyNurse, is going to talk to us for about 45 minutes. And then Agnes, who I will ask to introduce herself in a minute, will facilitate the questions and answers at the end. If there's anything that we don't get time to answer, then we will make sure that we do that offline, or you can also email the society with any questions, and we'll make sure that they're passed on to Agnes or Ariana. So I just wanted to say very briefly that actually nursing was a very big part of my life when my son was very poorly. Alfie was in hospital for many, many days, weeks at a time, sometimes with very severe epilepsy. And doctors never have time really to make relationships with people. They're in and out a lot of the time. They're always in a rush. But I used to go to Warwick Hospital with my little boy, which is at our local hospital, and we created amazing close relationships with the nursing staff there. They saw me at my worst and my best. They saw me at times when I felt I couldn't go on anymore. They listened to me when I wanted to talk to them about wanting to use medicinal cannabis with Alfie. They never made me feel like I was completely mad, which was lovely. And so I'm really grateful to the nurses that have been involved in Alfie's life and continue to be involved in his life, but not as much now, thankfully. But yeah, I just wanted to say that, you know, I'm really excited to chair this evening, because I feel, you know, nurses have played a big role in my life and my son's life. So thank you to them. Okay, I'll allow Agnes just to introduce herself first, and then we'll move on to Ariana, who's going to present. Just to say as well, if you have any questions to ask, please ask them during the talk, and they will come in to us, and then Agnes will facilitate asking them at the end, and we'll have about 15 minutes to ask questions. Okay, thank you very much.
Thank you, Hannah. Hello, everybody. Lovely to see so many on the forum today. I'm Agnes. I won't go into great detail about my background, but basically I am a nurse. I'm very proud to be a nurse and a district nurse. I'm also a Queen's nurse, and just to preempt any questions, a Queen's nurse is somebody who has been working in the community for at least 5 years, and they have got the support of their patients and other peers to acknowledge that they are working above and beyond the expectation of the role of the nurse. So I'm proud to be a Queen's nurse, and I am currently working with the Queen's Nursing Institute and working with CPASS. We have developed a program, a pilot program called Frontline Bridges, which is a shared care pilot program with the Queen's Nursing Institute, Hallam Medical and CPASS. And the aim is to promote, really focusing on what Hannah said, to really promote the role of the nurse in working with people who are prescribing cannabis. So currently we are working to support Drug Science, which is an organisation, and their project is T21 Project, and they're aiming to reach 20,000 patients. And we're also grateful to MCCS, who are helping us with the training for our nurses, because we have nurses that have volunteered to work as part of this pilot program, and they will be, the aim will be for them to work with expert clinical prescribers, who would be the doctors, and then the nurse would work with them to deliver shared partnership working, with the aim to monitor the progress of the patients that they are being cared for. And really we're wanting to highlight the importance of cannabis and how nurses can start to spread the word with other consultants and clinicians that they're working with, so that we get more clinicians on board. So I'm sure that there is a lot more I could say, but I don't want to squeeze into Ariana's time.
Thank you, Agnes and Hannah. It is so great to be here with you all today. Thank you for joining us. I'm really excited to be talking to you today. I'm going to go ahead and share my screen. I'll tell you a little bit about myself as we go through, but really you're not here to hear about me. So let's go ahead. And all right, there we go. Everybody should be able to see that now. Okay, so I am presenting today the role of nurses in medical cannabis care. So a little bit about me. I have a background in nursing, of course. I am a nurse entrepreneur, a nurse educator. I have worked as a holistic practitioner, as a business coach and consultant with others who have holistic businesses. I got my master's in nursing at Edinburgh University about a decade ago. I am an integrative nurse coach, and there's a whole bunch of other stuff there that my nursing career basically spanned in the States. It was children's acute care, so pediatric hospitals, as well as labor, delivery, and postpartum, and then of course education, including teaching nursing school clinicals at the university level, that sort of thing. I'm going through this fast because, again, it's not really about me, but I'm going to give you my conflict of interest disclosure here. Because I always think it's really important to think about when we're learning something new to find out who are we learning from, and, you know, what is it? I always try to ask, you know, what does this person want out of this? Why are they teaching this? Why are they talking about it? So I'm going to give that to you flat out because you should know that. So I teach the CannyNurse Certificate Programme, which is an online endocannabinology training program for nurses. It goes from LPNs, which are 2-year degree nurses that we have in the States, all the way up through advanced practice nurses. It's an online program, so it is available internationally. Right now, mostly we have American and Canadian nurses, but that's because that's where I come from. Though I live on the Isle of Lewis now in Scotland, so I'm very happy to be back in the UK after 10 years being in the States. So I'm going to tell you a little bit more about my bias, because frankly, everybody has a bias. And I think, again, it's really critical to know who is teaching what, because that's it's the grain of salt that we use to think about whether or not we want to actually believe someone. So I'm going to flat out tell you, because I don't see any need to hide it. And I want you to know that this is where I'm coming from, though I always try to be balanced. So I stand for regulated, lab-tested adult use cannabis. I think it is a far safer drug than alcohol and tobacco, and I think that adults should have the choice if they want to use cannabis to relax at the end of a stressful day. Now, regulated, lab-tested cannabis actually keeps people safe, and there's a lot of research that's coming out about this in the States, because when it's regulated and lab-tested, you don't have to worry about the fact that hemp and cannabis are amazing bioremediators. They are so good at cleaning the soil that hemp was planted around the site of the Chernobyl nuclear disaster because it's pulling all of the radioactive crap out of the soil. It's that good. The problem is if you're using it for medical reasons and all of this, you know, radioactive ions and heavy metals and pesticides and chemicals are in the soil, that does not make it safe for patients. So this is where regulation and lab testing really does make it safer. Adult use access to cannabis also prevents people from turning to synthetic cannabinoids. THC is a partial agonist to the cannabinoid 1 receptors. So what that means is that this is why you can't overdose on cannabis and die of respiratory arrest like you would on an opioid, because it's only a partial agonist. So what that means is that it doesn't work the receptor quite as well. And people used to say that it was because we didn't have cannabinoid receptors in the brainstem, but that's not true. These synthetic cannabinoids, however, are made to be full agonists, which makes them much more dangerous because they can activate those receptors and cause respiratory depression, which is that's why people die when they have an opioid overdose. So cannabis, actual plant-based cannabis, keeps people from turning to these synthetic and, you know, so-called legal alternatives. It also keeps our kids safe. When cannabis is regulated and lab tested in the dispensaries, they will get fined, they will get put out of business, they will they will risk their entire business if they sell to children who are, and I'm not talking about medical cannabis children patients, but just your teenagers looking to get high. Drug dealers don't really care who they sell to, but regulations keep us safer. So I stand for regulated, lab-tested adult use cannabis laws. I also stand for patient empowering medical cannabis programs. I stand for evidence-based practice and quality research. I stand for patient autonomy, education, and respect. I stand for openly, curiously, and actively listening to all of our patients. I stand for non-judgment, honoring patient experiences and seeking pragmatic harm reduction approaches as and when needed. I stand for holistic and integrative care that takes into account the whole person, their lifestyle, and their individual pursuits of health and happiness. Because I believe patients should be treated as the authority over their own body, rather than us assuming that we know what's best for them or that we're the experts and they don't know things. There's nobody that knows your own body better than you. And I feel like we owe it to our patients to acknowledge that and respect that. So that's me. that is where I'm coming to you from with all of this. So as I've said, now that you know who's speaking to you, let's get to you. And I want to let you know that I'm not going to be watching the chat box as we go through, but Hannah and Agnes are. So I get a little distracted with that. So we will get to your questions. And as Hannah said, if we don't get to your questions live on this tonight, then we'll respond to them. And I have my contact information in the last slide, so you will know how to reach me directly. All right, so today's agenda. We're going to talk about medical cannabis in the USA and what's happening over there. Not in great detail, but just enough to give you a sense of where I'm coming from again. And we're going to compare and contrast what's happening in the USA versus in the UK, and specifically with the focus on nursing care, because that's what we're here to talk about tonight. We're going to talk about cannabis nursing scope and standards of practice. We're going to talk about the US National Nursing Guidelines for medical cannabis, because yes, we do have guidelines for nursing care. We're going to talk about my CannyNurse Certificate Programme, which is the cannabis nurse training that I teach. And we're going to talk about, in practice, what do cannabis nurses do? And then, of course, we'll have our question and answer session. So we'll jump right into it. In the USA, basically the way that it works is that patients get a medical card from a recommending physician in their local jurisdiction. So in the US, we have laws that are state by state, even though we still have the federal Schedule I designation for cannabis, the states are able to sort of override that a little bit within their state. And the federal government has agreed that they're not going to fight it. It's kind of silly, and hopefully it'll get descheduled soon, but that's what we have. So when somebody wants to become a medical patient in the USA, the process is a little bit different than what happens here. So patients go to the doctor, they tell the doctor why they want to use cannabis. A lot of these are, quite honestly, you go and you show up and you pay your $100 or your $150 or your $200 or whatever they charge, and then they look through and they say, oh yes, you qualify for pain, anxiety, insomnia, whatever it is. So, and there's some, I don't love that system. I would love it more if it was something that more doctors were knowledgeable about, but right now they're not. But then what happens, once you get your medical card, the patients visit a dispensary. And when you go to the dispensary, you show your medical card, and that's what allows you to purchase products. So nothing is prescribed in this model. Basically, the recommending physician says, depending on states and how it works, they'll say you are allowed to buy X amount of cannabis, whether that is in the weight of the dry flower or whether that's in milligrams of THC. They give you an amount that you're allowed to buy. In some states, that's a rolling total. I believe other states do it differently. Most of the ones that I know about are rolling totals when it's medical. So that means that over 30 days, you can purchase X amount, but not more. And then on the 31st day, your allowance is sort of reset. It's similar to purchasing vitamins and herbs, where you go and you don't have necessarily great instruction on what to do with it. You can just go and buy it once you have your card. And in states that have adult use, they can just go into a dispensary. You still typically have to show your ID and that sort of thing. But I believe there are not those rolling totals. When it comes to what products to use, patients do their own research, they spend their own time and money, and it's basically a process of trial and error, of seeing what works. The bud tenders, who are the frontline salespeople, they help the patients with the product selection. And in some ways, this is really empowering because patients are recognized as the authority on their own bodies. And so they get to experiment with their own body as their canvas. You know, they get to see what works, what doesn't work. Sometimes that's a problem, because if you have a 24-year-old bud tender who, you know, enjoys getting high and doesn't really understand the medical consequences or the medical program or what medical goals patients might have, it can be a little dicey. And it's not necessarily ideal, but we'll talk about that a little bit more. The final part of the process is that patients get recertified. Typically, it's after a year. You go back to the same doctor. They ask, how's it going? Is cannabis working for you? And then they sign on for another year. And that's typically the process of how it works. So we'll do a little comparing and contrasting. And this is from my experience. I don't claim to be an expert and know everything on everywhere. That would be a lot of pressure. I don't need that kind of pressure. But this is my experience and my knowledge based on the work that I've done. So in the USA, cannabis is treated like an herbal supplement, although it's obviously much more highly regulated. When I say it's treated like an herbal supplement, what I mean is that you can buy it and you can use it however you want. There's nobody that is following you around to see how much you're taking and when. It's just, but the regulation, as I mentioned earlier, deals with making sure that things are lab tested so they're safe and that sort of thing. In this system, patients are really empowered to advocate for themselves, and they have to, which is not always great because sometimes patients are afraid to advocate for themselves, or they don't know how, or they don't know if they can. In this, patients are also empowered, though, to learn about their own bodies and their own conditions and their own medicine. And patients have to learn, hopefully with the help of a nurse or some other sort of healthcare practitioner, but often on their own, they have to learn how to self-titrate their own doses. So what this means is that with cannabis, what we want to do is we want the patients to find what's considered the sweet spot, because cannabis has biphasic properties, which many of you probably already know. But what that means is that a low dose can produce opposite effects to a high dose. So in low doses, THC might help relieve anxiety, but in high doses, it can cause anxiety and paranoia. So this is well known and it's well documented, but patients have to they've got to play with it a little bit. On the front line in this system are these bud tenders. Bud tenders are basically salespeople who work at the dispensaries and they sell products. They learn about the products. They do have good education, but not healthcare education. They have good product education. And typically, depending on where you go, of course, and depending on how good their education was, but typically these bud tenders know things about the different types of cannabis. They can tell you that, you know, this one is high in myrcene, or this one is high in terpinolene, or this one is high in linalool, or they can tell you things like that. They can talk about different products and different brands, but they're not healthcare practitioners. The nurse's role is still being defined in America, and it is in very much a work in progress. And there are groups like the American Cannabis Nurses Association and the Cannabis Nurses Network. And both of these groups are working to help bring education and more standards and more guidelines to our profession and to the specialty of cannabis nurses. Cannabis nurse coaches are really well poised to make a difference in patient lives. And we'll talk about that, what that really means as we go through. Right now, I'm going to tell you my experience of being in the UK, and my experience may not be universal, but what I've seen from being in the two different systems. In the UK, it feels a little more authoritarian and sort of patriarchal, like we expect from Western allopathic medicine. The doctors are on the front lines, they prescribe you something and you don't necessarily have a lot of choice. In the States, you can have, you go into the dispensary and you're allowed to buy whatever you want to buy. And there is that's very empowering, I think. In the UK, if you don't know, once you get your medical card, you can get a prescription sent to you basically from a mail order pharmacy. And that's whatever the doctors have prescribed you, that's what you get. From everything that I've seen, there are no walk-in dispensaries and you don't get those different options of the different chemovars. What I don't love about that is that it doesn't really take into account terpenes. Patients and clients don't know about lab testing. They don't understand necessarily because they haven't been exposed to a certificate of analysis, let's say, which in the States will tell you what terpenes are in your cannabis. It'll tell you, did it pass the tests for heavy metals and molds and microbes, and was that all passed, or was there some sort of an issue? Now, typically, if it's being sold in a regulated licensed dispensary, you're not going to have things that are over the toxic thresholds, but it's one of the things that it's part of the patient education that we do in the States. And I think it's one of those things where it's important to understand that if you're getting illicit street cannabis, you don't know what it could be contaminated with. I've also noticed it seems that there are fewer routes of administration available. Now, out in California or Colorado, the states that have been doing this for a really long time, there are tons of products and there are tons of options and lots of different ways that you can use cannabis. And what's nice about that, again, is it's that patient empowerment. The other thing I've seen is that besides the sort of lack of products and routes of administration is that there's still very much a focus on indica versus sativa. Now, I've put two different studies here that talk about this, McPartland and Russo, and they talk about that indica and sativa are not really scientifically accurate terms because of all the hybridization and these things that have gone on in cannabis. So essentially in the States, what we look at from a professional standpoint is type 1 chemovars, type 2, and type 3. Type 1 is THC predominant. Type 2 is balanced, which is like a 1-to-1 THC CBD and somewhere in that range. And then type 3 is CBD predominant. So it seems to me that the process is not quite as patient empowering here because it still is putting people in that position of, I'm the doctor, I'm going to prescribe this to you, and this is what you'll take. As for the nurse's role, I don't think we really know what that is yet. I know Agnes is working on it, and there are some wonderful groups that are looking at this, but we don't know what the role is yet because it's still relatively new. And in some ways that is super exciting because we can define it and we can say, hey, these are the lessons of what has worked elsewhere, and this is how we can empower our patients and keep them healthy. So it's kind of exciting. And also it can be a little bit of an adjustment if you're coming from elsewhere like I did. So why do we need nurses in cannabis care? Well, nurses are the most trusted profession. We're viewed as being the most ethical. And as Hannah mentioned, we are known for having that healing and caring relationship with our patients. We are experts in things like lifestyle modification and health promotion. Those are things that we do. We educate our patients as nurses and we coach them, even if we don't know that we're coaches. It's how we work with our patients for the most part. Cannabis is a safer choice than many pharmaceuticals when it's regulated. And I already told you why and how it can be toxic on the illicit market and how the synthetics are way worse. The thing is with cannabis, there's no black box warning. Our antidepressants can increase risk of suicide. Like that to me is crazy. That's the black box warning on pharmaceuticals. I don't know if you guys use that term over here, but it's very common in America that a black box warning is a medicine that can have severe or fatal consequences. And when I say cannabis is safe, I don't mean that it has no risks, that there aren't adverse reactions, because there are. You can die while using cannabis. It's just that cannabis is not going to cause you to go into respiratory depression and stop breathing and stop your heart from beating. But just like you can die walking across the street there are always ways that bad things can happen to us. It's just that when I look at choices, to me, cannabis is a much safer choice. The great thing with nurse coaches is that we are really good at helping patients make lifestyle adjustments. We see our patients more frequently and we spend more time with patients. And we do have, as I mentioned before, scope and standards of practice. These were developed by the American Cannabis Nurses Association in 2017. I put the link right here for you. So, and I did send over a copy of my slides to Hannah. So I think those can be made available to you. If not, email me. My email's at the end of the presentation. So the standards of practice cover assessment, nursing diagnoses, outcomes identification, planning, implementation, evaluation, ethics, culturally congruent practice, which is especially important in the USA. It has been a big problem because there is a huge problem in the States with Black and brown people being treated differently by the police, by the government, by the system as it stands. I'm sure you have heard plenty about that. I don't need to tell you, but it's especially important in cannabis because there are a lot of issues surrounding communities of color and Indigenous communities. And so this is really important in the States specifically. It also covers communication, collaboration, leadership, education, evidence-based practice and research, quality of practice, professional practice evaluation, resource utilization, and environmental health. So as you can see, these are really comprehensive standards of practice that have been set up. We also have the National Council of State Boards of Nursing in the United States, which gave us cannabis nursing guidelines. So this is the link for that right here. Basically, they talk about 6 principles of essential knowledge, and these are the things that the National Council of State Boards of Nursing feels are important for nurses to know when it comes to cannabis care and care of the patient using cannabis. They also have guidance for advanced practice nurses, and those are the nurses in the states that have prescriptive authority. So I know that there are some nurses over here that also have prescriptive authority. So we have guidelines for that sort of thing in the States. Doesn't mean that our guidelines are perfect or the best or, but there are existing guidelines, and I know Canada has guidelines as well. So that's just to give you a sense that we do have those. These are those 6 principles of essential knowledge that I have for you. So they say that the nurse shall have a working knowledge of the current state of legalization of medical and recreational cannabis use, and a working knowledge of the jurisdiction's MMP, which stands for Medical Marijuana Program. It also says that the nurse shall have an understanding of the endocannabinoid system, cannabinoid receptors, cannabinoids, and the interactions between them. The nurse shall have an understanding of cannabis pharmacology and the research associated with the medical use of cannabis. The nurse shall be able to identify the safety considerations for the patient use of cannabis, and the nurse shall approach the patient without judgment regarding the patient's choice of treatment or preferences in managing pain and other distressing symptoms. Now, there's a big document that goes through all of this. That's the one I linked to a minute ago. And so it's like, great, we have guidelines, but it's still really difficult in the States for nurses to get the education that they need. So I want to tell you a little bit about what we do have for education. Right now in the States, the endocannabinoid system is still not widely taught in nursing schools or medical schools, despite the fact that it has been discovered and understood now as the master regulatory system of the whole body. There are beginning to be some university level courses in cannabis science. There's the Pacific College of Health Science. They have a medical cannabis certificate, and that's the program that I attended. It was a 6-month full-time program that pretty much changed my life and is why I'm here talking to you about this tonight. The University of Maryland also has a master's degree in cannabis science and therapeutics. There are also some online courses. They're mostly of varied durations. Most of them are short, less than 6 hours. And a lot of times they're not nursing specific. So because of that, I created the CannyNurse Certificate Programme. This is what I believe needs to be taught to nurses. And I'm not here to sell you on my program, but I want to talk about the things that I think are really critical for nurses to know and to understand. This is a first of its kind program. I haven't seen any other programs out there for nurses, certainly nothing that is 50 hours long, that is so comprehensive. And this is information that I think all nurses need to know. So when I teach it, I talk about the scope and standards of practice in a little more detail than what I already gave you. But we talk about that. We talk about the physiology of the endocannabinoid system, because really, I think we should be endocannabinology nurses, not cannabis nurses. It's called the endocannabinoid system because THC was the key that unlocked our knowledge of it. They basically went looking for, they said, we have THC, we know it has these effects on the body, and how does it do that? If there's a key, there must be a lock. And so they went searching for that receptor that was the lock that fit the key that was THC. And the endocannabinoid system is amazing. It is all about balance and keeping our whole body balanced, everything, all the bits and pieces. So understanding that physiology, to me, that's one of the most important things that nurses need to understand, and all nurses, not just cannabis nurses, not just people who believe that cannabis is a medicine. But this is as important to our bodies as the skeletal system. It's just that it's more subtle. So it took us longer to discover it. So we also talk about cannabis pharmacology, cannabinoids, the entourage effect. What's the difference between isolates and full spectrum or broad spectrum products? What does it mean? What's the benefit of the terpenes? How do they contribute to the healing powers of these plants? We talk about cannabis research, cannabis dosage and routes of administration. We talk about cannabis contraindications, who should not use cannabis. We talk about vulnerable populations. So that's looking at the elderly, pregnancy, children. We also talk about social justice issues because, as I mentioned before, and as I'm sure you've heard, we've got a bunch of those in America that we need to deal with. So the second half of the program is medical conditions and therapeutic cannabis. And there's some amazing tools. I looked on PubMed the other day, there were almost 70,000 studies on cannabis. And that is a huge amount. We know a ton about cannabis. It's just that information has not been disseminated. We don't know everything that we want to know, but we know a lot. There are 70,000 studies. That's more than studies on lavender and St. John's wort. That's more than echinacea, elderberry. You know, there are these things that we use all the time or that are common practice that are not nearly as well researched as cannabis. We talk about product selection and safety also, because as I mentioned, cannabis nurses have to be able to help patients navigate what kind of product is going to work best for whatever you're looking to accomplish, really looking at their goals and how do they find something that works that will give the patients the relief that they want without the things that they don't want. We also talk about cannabis use disorder and adverse reactions, because there are some. Cannabis is safe, yes, but it's not completely safe that anybody can take it and have as much as they want. So I educate my nurses on what they need to look for and what they need to educate their patients on, so that we don't have patients showing up at the emergency department because they took too many edibles. That's such a huge problem, and patients just aren't educated. And as much as I can appreciate the knowledge that bud tenders may have, a lot of them seem to be young and they don't understand that as we age, our metabolism changes, and that there are lots of different conditions that can affect that affect our bodies and how medicines interact with our bodies. We also talk a lot about holistic modalities and lifestyle medicine in the endocannabinoid system. And that's because I want us to be endocannabinology nurses. I want us to understand how the body brings balance. And then we talk about care plans. What is the plan of care for a patient? What does it look like over time? So that's what I teach. And that is what I believe nurses need to know and be educated on. It's a lot. I mean, there is so much information out there. We have one cannabis nursing textbook in existence. Like, there are lots of books, but one textbook, that's it. But we have 70,000 studies in PubMed. So how do you figure out all of that knowledge on your own? It is really hard. And so we have to work together, and we have to educate ourselves. So that's kind of the basis of the knowledge that I think is really important. This we're going to talk about here is cannabis nurse coaches in practice. So I want to talk a little bit about the coaching model first. The philosophical basis of coaching is a holistic health model. It's integrative wellness, or psychoneuroimmunology, which is the whole concept of body, mind, spirit wellness. So with coaching, we're looking at the patient as a whole. We're not just looking at their medical condition, we're looking at their lifestyle, how they sleep, how they're pooping, you know, all of those things that we talk about as nurses. We integrate that into one model of care so that we can really get a good sense of what a person is dealing with, so that we don't get so many of those, oh yeah, by the way, I haven't slept a full night in 10 years kind of things at the very end of, you know, when they're walking out of the hospital or something. The tools that we use for coaching are things like mindfulness, motivational interviewing, active listening, and open-ended questions. It's really about empowering and educating clients and working with them, helping them to listen to and to nurture their own inner authority and make lasting health promoting choices. One of the things I was amazed about when I came and did my master's in Edinburgh was that you guys in the UK have an amazing focus with nurses on health promotion, and we don't have that as much in America. And I always say that's because if you follow the money, the UK national health system in each country saves money when people are well. So it benefits the system financially to have healthy people. In America, we make money when people are sick, which is a pretty sick system, I think, but that's what it is. So for nurses in the UK who are already so good at health promotion, to me, this feels like a really wonderful fit, because it is about empowering and educating and helping patients to make lasting changes. So what do cannabis nurse coaches do in practice? I'm trying to make sure I don't run over our time here, so I apologize if I'm garbling things a little bit. In the States, clients pay out of pocket, which is the case for most medical care in the States. And typically coaches will sell individual sessions or packages. So they'll meet with their clients on a recurring basis. It could be weekly, could be bi-weekly, could be monthly. We have a little bit of a tricky space with cannabis in that nurses can't tell clients what dose to take. So when a patient comes in and they have been given no instruction from their recommending doctor, as is almost always the case, we can't tell a patient to start with a certain dose. What we can tell patients, we can educate them, and we can say that, you know, this is the study by McCallum and Russo, and it says that for most patients, starting at 2.5 milligrams of cannabis is a good place to start. And it also says that if you're an elderly patient, you might want to start at 1.5 milligrams of THC. We can give them the information and we can educate them, but we can't tell them you should start at 1.25 milligrams of THC. So it's a little bit of a kind of a weird thing. It would be nice if we could be a little bit more specific, but what we can do is we can educate and inform our patients, and we can answer questions of whether it's about cannabis, the endocannabinoid system, their disease process, how different products might react with their bodies. And so mostly what we're doing in these cases is we're guiding patients through the process of self-titrating their medicine. So we're really focusing on telling them to go slow, to start low, go slow, and stay low. And again, those are evidence-based guidelines from McCallum and Russo. So we can talk about that with our patients, and we can help them, because a lot of times bud tenders will say, yeah, 10 milligrams, or, you know, you can buy these gummies because they're extra strength or things like that. And I don't love that about our system. I think patients need more guidance, but that's not the way it's been set up yet. So cannabis nurses are working that way, and they're doing that. And I'm hoping that in time, we will have some shifts to where more people are utilizing actual healthcare practitioners in their process of self-medicating. But we don't have that yet, which is, again, why I think it's exciting to be in the UK, because this is still relatively new here. So maybe we can find a way that is empowering the patients, but also gives them the information that they need, because we don't want patients going to the emergency room because they took too much of an edible because the 24-year-old bud tender said, yeah, 10 milligrams is good. I hate that. So in practice, in a typical session, this is how we would work with patients. And this is what I look at as kind of the best of both worlds, because you have a healthcare practitioner who is working with your patients, but they're also being empowered to pay attention to their bodies and to listen to their bodies. So in a cannabis nurse coaching session, typically we start by reviewing your recent progress. So what's working for you? What isn't? How are things going? We just kind of ask an open-ended question like that, as nurses do very often. And we just kind of gather some information to find out what's going on with the patients. Sometimes part of our job is normalizing patient experiences. Yes, it might be normal for you to have a little tachycardia when you have your first dose, or if you take a dose that's a little bit too high, or maybe you'll have that in the beginning and then it will sort of calm down as you get into the experience a little bit more. Helping patients know what to expect and what things are not normal is a really good way to help them pay attention so that they can adjust their dosage. Like, well, if this helps with your anxiety here, but you took this dose and it's making you feel really anxious, maybe we need to back that down a little bit. And, so we can help patients to understand what's normal and what isn't, so they know when to ask for more help. We can also answer questions about cannabis usage, like how to use it, how to take it, what kind of route of administration is better. I mentioned earlier that from what I've seen, it doesn't look like the UK really has true sublingual options. And that's because, and there are studies showing that even Sativex, which is the poster child for oromucosal administration of cannabinoids, there's an expert consensus out there that says, actually, we think most of this goes the oral route. So telling patients, if patients don't know this, and without having to give you all of the, sort of how it works in the body, basically, if you have something that's sublingual, it should take effect within about 15 minutes because it goes right into the mouth, into all the little blood vessels in your mouth. I won't show you mine, but there's a lot of them in there. And so the medicine goes straight into the bloodstream, so your body doesn't have to process it. On the other hand, if you eat something or take drops that go the oral route, it goes through your digestive system. So when it goes through your digestive system, what happens is the liver actually processes that THC and it turns it into a different form. It's called 11-hydroxy-THC. 11-hydroxy-THC lasts a lot longer and is more intoxicating. So that's why people, when they eat too much of an edible or they take too much of oral drops, something like that, that's why they can have really scary experiences, because it gets processed by your body so that it ends up lasting longer and feeling stronger. Now, why that's important is because if somebody takes some drops thinking that they're sublingual, that they're going to absorb in 15 minutes, sublingual tinctures, the effects should typically be gone in a couple of hours if it's a true sublingual. However, if it gets washed down the throat, things that go through the oral route, that go through the digestive process, those things can affect your system for 8 hours. So if you have somebody that doesn't feel a lot because it's sublingual and it's going to take 2 hours for the effects to start hitting, they might take more. And so saying something is a tincture and then somebody takes it and then they take another dose because they haven't felt it, but the body hasn't processed yet, that's a recipe for an uncomfortable experience. And so that's the kind of thing that we work on with our patients to make sure they really understand what medicine they have, how they're using it, and what to affect so that they don't have those adverse experiences. We also talk about how cannabis interacts with their medications and their medical conditions. So we can talk about things like inflammation and how cannabis can be neuroprotective, and we can discuss that with them in a way obviously bud tenders can't, because they don't have that healthcare knowledge and background. The other thing that we often do in sessions is to share research with the patients so that they can start to have a little bit more knowledge, understanding, and empowerment in their own condition. That is one of the fundamental sort of philosophical bases of nurse coaching, in that it is really about empowering and honoring the patient's experience. And cannabis is a great way to do that. I've got a few more slides. I'm going to go through them quickly because I'm realizing we're getting pretty late. In practice, I talked about these talk about in our sessions, lots of education, you know, because everyone comes in with, oh, there's this miracle cure. And if you do this, blah, 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 you know, we all know there are no miracle cures, but the media makes it look like there are. So we do a lot of that and helping them fine tune the effects they're really looking for. So I ask, what could the nurse's role be in the UK? Because it's still, medical cannabis is still in its infancy here, you know, we have that opportunity. We can define the roles. We have challenges though. Stigma and lack of education are huge ones. Though there's so much that we know. People keep saying that there's not enough evidence. And I've heard that from my students over and over again, because that's sort of the party line. That's what everybody says, what everybody thinks. We just don't have the research. We have almost 70,000 studies in PubMed. Now, some of those are on adverse effects, and some of those are looking at cannabis as a drug of abuse and all of these kind of things. So they're not all necessarily therapeutic cannabis studies, but there is a lot of research on cannabis. It is the most researched plant in the world. That's why it's been known for years as the people's plant. It's something that it is relatively safe. It is effective for a wide variety of conditions. And until prohibition, cannabis was really easily accessible. This isn't a case of talking about opioids, things that can give you a fatal overdose. We're not talking about selling to children. We're talking about regulated medical cannabis, and it is a game changer for patients and nurses. And we can lead the way in this. The endocannabinoid system is all about balance. That is its whole job. And I think that is the coolest thing. It is about balance, creating balance in our lives, in our patients, in our health. It's not about trying too hard or working ourselves to the bone. It's about finding balance. And I think we all need that in our lives. So let's empower our patients to achieve better balance in their lives and in their health. There's so much that I could say, but it can be a really beautiful thing when you have a patient who is empowered, who understands their body and their medicine, whatever medicine it is. It is incredibly empowering, and we have the chance to make a difference. So thank you very much for being here. This is my contact information. You can see my course listing is right there. My email address is there. A very nice picture of me, if I do say so myself. I didn't put on quite so much makeup tonight, but hopefully you don't mind. Thank you all so much. I know we've got questions and answers. So what do you think, Hannah? Should I stop screen sharing or leave it for another second for people to write it down?
Yeah, no, leave the slides on, that's fine, just so if people want to write anything down. Thank you so much, Ariana, that was brilliant, really, really interesting. And yeah, it's wonderful to hear so much passion about, you know, I feel the same. It can change people's lives. I've seen it myself. So thank you so much for advocating for nursing so well. So thank you very much. I'll pass over to Agnes now, who's going to talk. We've only got a couple of questions, but if there's anything else anyone wants to ask, then please do. If not, then we can you know, we can finish early. We've got just more than 5 minutes anyway, so I'm sure by the time we've answered these 2 questions, we'll be ready to be done. Thanks, Agnes.
Okay.
All right.
Yeah,
well, thank you. I'm just going to begin actually by comments, because there are so many comments in the chat box about how powerful your presentation was, Ariana. So thank you so much. I think everybody has learnt so much from you in less than an hour. It was, and your enthusiasm came across. Anyway, let's get on with the questions. The first one is, I am an NHS mental health nurse and work in the community, and one patient I work with has a legal prescription. How can I best advocate for my patient, as the team are very concerned, and I feel this is largely stigma and lack of understanding? Where can I go for accurate information that my colleagues would respect?
That's a great question. Thank you for that question. I would say I'm happy to share any information that I can. So if there are things that are specific, email me and I will send you what I have and what I can find. There is a PubMed is a great place to search. There is also this amazing research tool that's called CannyKeys, and they basically, it's like a database that compiles all of the research. It's not quite ready for unveiling in the UK, but it will be. So in the meantime, please feel free to email me. But PubMed is a great source. There are lots of great things. I would say typically what I've found with mental health practitioners is that they're concerned because they're coming from the lens of substance abuse. And there is cannabis use disorder is a real defined thing that has diagnostic criteria. And many people are concerned about that. One of the things about the criteria though, is that it makes an exception for patients who are experiencing tolerance or withdrawal symptoms for patients who are supervised under a qualified physician or healthcare provider. There are a lot of great reviews, literature reviews, meta-analyses, things like that on PubMed. And if anybody doesn't know where to go, it's pubmed.gov. So PUB, like published, I guess, med, like medical, med.gov, G-O-V, and that's our American government. I think it's the National Institutes of Health runs that. But you can do a search for cannabis or marijuana and any specific topic you're looking into. I have a real passion for cannabis and depression. So if, depending on what your client is going through, I'm happy to share resources that I have, that I've vetted, that I've looked at for a long time. But PubMed is my go-to. It's hard because there's a lot out there and you have to read through a lot of these things, but that's why I've spent literally the last year feeling like nonstop, all I'm doing is reading research articles. So I'm happy to share if there are like very specific questions, I can send you like specific articles that I found on certain things, but to search for yourself, pubmed.gov. That is, there's like I said, there's almost 70,000 studies there, so it's a lot to wade through. But yeah.
Could I just, thank you, Ariana, could I just add as well, the Medical Cannabis Clinicians Society, if you become a member, we do have an evidence base as well, which you can access, which has a list of symptoms and evidence that's current, which we had published at the beginning of this year. So that's a really good tool as well. We also have created, our doctors on our committee have created lots of working pamphlets which talk about CBD, talk about evidence, talk about how to access medicinal cannabis, that sort of thing. So there's a lot of support on that website as well, which is ukmccs.org. So we welcome all clinical and allied health members as well. I forgot to say that at the beginning of my little speech at the beginning. So if anyone wants to join us, you will access that evidence base as well if you're a member. So sorry, Agnes.
No, if I can just add to that one before we go on to the next question. There is CPASS have an MDT seminar on the 13th of September in the evening. And we can put details on the link later on. And that is looking at medical cannabis and mental health, and they're discussing a case study, which the previous question, the person may be interested in that. So that will be CPASS, canpass.org.
Thank you.
Okay.
Yeah, I would add too, real quick, because I think that's great to have the case studies and to be able to go and talk about that will be really useful. I would say also that with mental health, a lot of the research really is focusing on CBD, because CBD is it's fantastic for a lot of mood disorders and things like that. So CBD from cannabis is certainly better than CBD from hemp, but you always want to make sure that it's lab tested and regulated. And there is research on that as well on PubMed. MCCS does have fantastic resources, and I'm so sorry, I can't even believe I forgot to mention that, Hannah.
Okay. That's my job. It's fine, Ariana.
Okay, before we run out of time, I'll go on to the next question.
Okay.
Can a cannabis nurse coach possibly work with patients in the UK if the patient can afford to do so, or would there be restrictions?
So I can't speak to, I don't know if there would be specific legal ramifications. I know that as nurses who practice in the United States, we can do education and coaching work with patients anywhere, because we can work, via Zoom or Skype or whatever. There are some questions, like there might be some jurisdictions where it's not allowed, but I haven't seen anything, because essentially, again, we're talking about education. So I think that nurse coaches who are educating patients and helping work on changes and things like that, we're not handing out cannabis, we're not giving any samples, we're not administering it to patients. So I don't see any reason why we couldn't, but that's not to say that there wouldn't be a country in the world who would not appreciate us talking to their people, but I mean, US to UK, I don't think that's a problem. And I have a whole crop of Canny nurses who are getting ready to graduate in a month. So, so there will be a fair number.
I think it makes sense, just from my personal, with the developing clinic model and hopefully in the long run NHS prescribing, that nurses very much need to be part of that. And is that something, Agnes, is that something, the work you're doing, is that about bringing nurses to be more involved with the prescribing? Or yes, not the prescribing, but the support side of it.
Yes, because as Ariana has alluded to, nurses are known for their, and with due respect to all other health practitioners, but they are known for giving holistic care and taking account of every aspect of a patient's life. So the aim is for them to work closely with the medical prescriber, but the nurse will be looking at that bigger picture, rather than just that one particular condition or episode that may have occurred. And I think, again, it goes back to what Ariana has said. If you're looking at that whole person and you're taking account of everything, then you're going to get a more holistic approach and well-being promoted for that individual.
Yeah.
Okay.
Absolutely.
Thank you. Yes, that's brilliant. And I can't believe it's 7 o'clock. Well done, everyone. I'll just say very quickly, if people haven't seen the chat box, you can also go to canpass.org, which Agnes has mentioned, but that's the nurses' arm for CanPass. So if you're a nurse that's interested in getting involved more and you don't know about CanPass, then please contact them as well, and they will be able to support you. And yeah, just thank you so much to both of you. It gives me so much hope when I hear people like you talking, because I think when you're in it and you're hoping for it to be better, you sometimes feel like you're not getting anywhere. And then when you hear people like yourselves talking, I feel real hope that we're going to do really good, amazing work for patients in the UK, and all of us together, I'm sure we're going to make it much better for patients and their families. So thank you so much to all of you, and all of you watching at home, thank you. And the most important thing that you can do with regard to my thoughts is, however frightening it must feel to sort of support patients who want to use cannabis or prescribed cannabis, when colleagues don't like that, then that is a scary place to be. But it's so important that you advocate for those people, because that's the only way that we're going to see change, is by people in the clinical world standing up. It's all well and good people like me doing it, but I'm not a doctor and I'm not a nurse, and so people like you are what are going to make the change. So thank you very much for you doing everything you do.
Yeah. Thank you so much for having me and for being here. I saw one thing real quick in the a couple of you put your email addresses. I think
I've
that
written
I will.
Them all down. I've written them
have
all
you?
down.
Okay,
Ariana,
good. Because I was like, I don't know if I'll lose these. And somebody asked if I would be willing to help with competencies for nurses in the UK. I absolutely would be happy to. Anything. I don't do this because, like, this is not my main income producer. I do this because I think it's really important. So I'm happy to be a resource and help. I'm so excited that we have so many people here that are wanting to learn about this and wanting to be part of it. I'm so honored to be here. So thank you so much for having me.
Well, thank you, Hannah, because that's what the nurses' arm is looking at. We're looking at developing competencies. So we will probably be in touch with you and continue this conversation outside of this.
Yeah, and
Yeah.
I think it's really important that we all collaborate and work together, and that's how we'll make changes, by supporting each other. I have put your email address on the chat as well, Ariana, so if people want to quickly write it down, because I did write as many down as I could, but if I've missed anything, then please contact Ariana directly, or if you haven't got her email address and haven't written it down, then contact the Society and I will connect you with Ariana. So thank you very much, everyone. Have a lovely evening. Thank you for joining us, and thank you so much to Agnes Fanning and Ariana Ayu, who have given their time to help educate nursing in the UK. And I'm sure we'll be back again for another nursing webinar, because it's been really good. So thank you very much.